Well, thanks very much for having me. And I think people may wonder why the heck is MasterCard on a call around global health? And I'll tell you the story behind that. But what I like to tell people is that Amazon is not a river, Apple is not a fruit, and MasterCard is not a credit card company. We're a technology company that happens to have grown up in the payment space. And we have been evolving since then into a number of new areas, including touching on the area of global health. We come at this from a focus on inclusion, financial inclusion in particular. And 5 years ago, we set out the goal of bringing 500 million people into the financial system who are unbanked, underbanked, excluded from networks. We achieved that goal. We measure that like any other corporate priority of ours. Every region has goals, every country has goals, we programs, we track it. People are compensated in part on achieving their goals. And we achieved it about 9 months ahead of schedule. And then in the midst of COVID, we were looking around, and it underscored for us just how important it is for individuals and micro and small businesses to be part of the digital economy in order to survive and to thrive, whether it's the mechanism by which governments are providing support, or their ability to interact with their community and their customers. We doubled down. We said we're going to raise our goal now to 1 billion people, 50 million micro merchants, 25 million women-owned, women-run entrepreneurs around the world, making sure that they're part of the digital economy and that they can thrive. Along this journey of financial inclusion, we met Gilead. And I have to give Gilead credit for introducing us to the healthcare area. And it was through a pilot program that we did in Pakistan, where we used our simply a very simple card, a chip, as Gilead was rolling out its Hep C treatments, to keep track of how often a patient came into the clinic to get their various treatments. And when they failed to come in, to send them an SMS reminder. And that sort of entered us into the global health area. And we now have a partnership. It had nothing to do with payments, by the way. It was simply the fact that sorry, I'm having a trouble with Skype or with Zoom. The fact that we had a network, we had technology, we had encryption, and we had the ability to keep track of when people transacted, in this case, came into a clinic. And now we have a partnership with Gavi to do something quite similar, of being able to help give people digital identity, to keep track of the vaccinations that they're getting for their children or for themselves, to have an electronic health record effectively on their device or on a card, encrypted, so if they go to another clinic, they can keep track of where they are, to remind them of when it's time to come in for a booster or for another vaccine. And similarly, we're working with the Global Fund to see how to use our technology to address the challenges that they have, maybe even combining payment and healthcare to, for example, to keep teenage girls in places where they might drop out of school, get into trouble, become carriers of AIDS, to stay in school, to incentivize them to stay in school and to keep track of their progress there. And so sometimes it has nothing to do with payments. It's really about how to use our network and our technology. We're with the Gates Foundation and Welcome, we created the COVID Therapeutics Accelerator, which now has, I think, more than a dozen participants and more than $300 million being put towards accelerating and expediting the development and deployment of treatments. And we hope to continue to provide our products, our services, our technology, our understanding of ecosystems, our network, to be able to help support the global health infrastructure, particularly in developing countries.